Guys, this is Stacy from Easy Acupuncture School. Welcome back. What if I told you that I could show you a special technique that would make your acupuncture, no matter what type of acupuncture you're doing, uh, probably 30 to 35% or above more successful? You know what you'd be doing? You would be shelling out the cash, right? But today I'm going to show you what to do. No cash needed. um, Today we're going to talk about how to interact with your patient. This is part one. The stuff that I'm going to talk about today is not magic, superpowers, or anything like that. It's stuff that you probably, after about 3 years of practicing, would figure all of this out. But why don't I go ahead and give you the information now so you don't have to figure it out? And once again, the information that I'm giving you, just like some of the stuff that we've talked about before, it's not the end all be all of how you do it. You don't have to do it exactly like I am saying, like in the paperwork or the the documents that go along with this lecture that you can download if you sign up for my newsletter, um, will have even where I'll put in quotes about what I say. You don't have to say and memorize what I say, but it's just giving you a guideline of what to say, potentially. Make it your own, because when you make it your own, it's going to be better anyway. But I'm giving you what I say, how I start interacting with a person until I finish interacting with the person. And you might say, well, I don't need to know that. I just want to know how to stick needles in people. I want the magic stuff. Well, this is the magic stuff. Because guys, the thing is, you need to build a rapport with your patient. If your patient is not comfortable in your skill, then you need to go back to school. No, if your patient is not confident and are comfortable with your ability, is not confident that you know what you're doing, or doesn't like you, then the treatment is more than likely not going to work. It's just like I have patients that come in that will have procedures done that typically for other folks will work, but then but they are bound and determined that whatever they've had done won't work. So inevitably, they'll still have problems. Like somebody will get an ablation, a heart ablation, and typically those work pretty well. Sounds a little scary. It's not as bad as I mean, I haven't had one personally, but from the feedback of from patients, I've had many patients that have had it. It's not that bad of a procedure, and it really helps with some of their irregularities in the heartbeat. But I have every once in a while a patient, if they don't believe in what they're getting, doesn't matter who did it, where it was done, how much of an expert the person was, they'll be like, "Oh, that didn't work. That didn't work." You talk to them about certain medications, and all medications that don't work for everyone. I understand that, but if they think this medication that typically works for 90% of everybody is not going to work for them, then guess what? That medication is probably not going to work for them. So this is why I'm providing you guys these skills. There was a study that talked about that was out. Gosh, it had just come out when I started practicing. So that was a long time ago. That was probably like 13. The study was probably like 15 years ago. But they found that all medicine, doesn't matter if it's Eastern, Western, Northern, Southern, doesn't matter. Doesn't matter. All medicine. You could look at pharmaceuticals as well as surgeries. You could look at acupuncture. You could look at Ayurvedic medicine, whatever medicine. The study showed that all medicines had about a 20% placebo effect, meaning like if you believe this little blue pill is going to work for whatever, it'll probably work. But if you don't believe this blue pill is going to work for anything, then it's not going to work. Just like with acupuncture, if you believe this is going to really help you, then more than likely it is. If you believe it's not, I have occasionally patients that come in that were forced to come to get acupuncture by other people. Those patients, a lot of times, not everybody, because some people turn around, but if they're just like, I'm in here because my wife made me be in here, and they're talking about that every time I see them, I know it's kind of an uphill battle with them to get something to be successful to happen. I had a guy that was like, "Oh, I can't relax. I can't relax. I can't relax." And I was like, "Okay." And I worked with him. And every time I'd come in this room, or my office room, he would be on the table snoring. I mean, the windows are rattling. He's snoring so loud. And then I would say, "Oh, did you relax a little bit?" I didn't relax at all. I told you it would work. So, if you have somebody like that, then it probably won't work for them. But if you have somebody that's open for the treatment, then this will just make the treatment even better. So let's start. I will probably have to go for this first thing. I've got a patient coming in soon, but let's get on the pathway a little bit, okay? I hope you guys are having a fabulous day wherever you're at. Was a little rainy here earlier, and now it's cleared up to be a pretty day. It's kind of how life is sometimes. Oh, wait a minute, wait a minute. Something's going on. Escape. I didn't do my share. Sorry. Let's do that again. Share. Blink. Just so you can see my beautiful face. Maybe you don't want to see that. Okay. So this is going to be called How to Interact with Your Patients. There we go. That menu out of the way. So who am I? You guys already know who I am. I'm Stacy Hewitt, trying to make the mystical practical. That's what I'm doing. Been doing acupuncture for 13 years, have been teaching for 7. Here's my contact information, easyacuschool at gmail.com. If you're trying to get access to the documents for these lectures and on my the website link that's supposed to be giving you access where you can sign up for the newsletter, if that's not working, uh, this email me at this email address. But anyway, I've been around the block for a little bit. Here's my channel with the rest of my amazing lectures. Check them out. So smile. So smile. Why do I say that? So the very first thing with patient interaction is a smile. And what do I mean by that? So when I was in clinic a long time ago, I remember, and trust me, everybody's nervous. And that's part of this is like how to conquer some of the nerves going down to the clinic. And this is information for you to prepare you for clinic. But I remember our clinic was downstairs. We had this long hallway with doors to each treatment room. And students would be out in that hallway doing qigong, breathing methods, tai chi, to try to calm their nerves, to get their spirits right, to go in and treat somebody. And because they were nervous, because they were like, I need to set my chi right so I can go in there and provide a good treatment for somebody. They'd be all tai chi in and out, relaxing up there trying to meditate in a chair. You know, I was probably one of them too, because I was nervous when I was in clinic. But let me tell you a little technique. let me tell you a little technique. If you want to try to calm your nerves, if you want to try to get yourself centered before you see a patient, as soon as you touch that handle, guess what you do? You smile. I mean, every video that you guys have seen, what am I doing? I'm smiling, probably pointing a little too much too, but you don't have to point, but smile. Ding. If I had a little special effect, I'd have the ding, special effect going on. But if you smile, guess what happens? Let's talk about this. You're like, Stacy, you're that's foolish. But no, you smile, and smiling brings the shin, you can't see my chest, brings the shin out of your chest. Sometimes our shins hidden. It brings it out and brings it to the forefront. I was just watching a class the other day, and it was about a Korean type of medicine. And one of the things that was really interesting to me was they were saying part of this type of acupuncture is about really incorporating all the knowledge you have, bringing it inside and assimilating it, digesting it, and then when you're treating the patient, bring it out from your chest. It's like this medicine's coming from the heart. And I thought, oh, that's a really neat way to look at it. You bring all this information in, and once you really understand it, and when you're treating a patient, you're letting the information out from your heart. I don't like that. But anyway, so think about this though. So when you smile, if you smile, oh, smile. If you're nervous, smiling brings your shin to the surface. It's like you want to give people, you want to give from yourself. You want to allow the healing to begin. It's like you're the conduit for it. Bring it out. Because what happens to our shin when we're nervous? Maybe water is putting a little bit of that fire out. What is water? Fear. Water, that element controls the fire element, right? When we get a little scared, maybe a little bit too much water is getting over there on the fire, and it's putting putting our flame out. Or maybe you're starting to worry a little bit. You're thinking either you're being fearful and being like, I don't know if I can do this, or you're starting to worry a little bit. It's like, oh, do I know everything I need to know to be able to treat someone? What if I don't know what to do? You'll always know what to do. And I'll tell you why you'll always know what to do in a second. It's maybe some of that worry, which is what? The child of fire, right? Maybe it's starting to replete, starting to rebel back up into the fire and throwing a little dirt on top of it and dampening it out. And it's going to be like that little childhood song about this little light of mine. I'm going to let it shine. Put it under a bushel, no. You know, that used to be like you grab your thumb when you're a kid when you're singing that song. I'm going to let it shine. That's what you're going to do. You're going to let your shin from inside here, you can't see my chest, but I'm pointing at it. Inside here, inside your heart, come out. I know this is sounding a little new agey, but it's not. It's true. Try it out. If you're nervous, right as you're getting ready to go into that room, smile. And it makes things so much better. And why did I say you're always going to know what to do? Well, I've got another lecture about what to do when you don't know what to do, but that's not why you're going to always know what to do. Is you have spent 3 years building up your willpower just to get through school. I mean, you're having to use your willpower just to get through school. You're having to train those kidneys to put out because you've got to have the bravery of going through school. You have to have the bravery of stopping your life to study. So if you can push through that, you can push through anything. That's why even when you don't know what to do, you're going to push through and figure it out. You're going to figure it out. It's not like you're going to walk in the room and the patient's going to bite your head off. And if they do, guess what? You've already spent 3 years schlepping through, pushing through not the most immovable objects, but you've been pushing really hard. So guess what? Your will is strong because you've gotten through everything. And if they bite your head off, it's going to just regenerate. It's going to regrow, you know, and I don't know which lecture I would. Well, this is just fine. I'll talk about it in this lecture. You know, I've seen probably, and I'm not trying to toot my own horn, but I calculated it up, probably around a little over 10,000 people. And I remember taking the class when I first started, and some guy talking about that, and I was going like, "Oh my God, that's an ungodly number." Trust me, if you practice long enough, you'll get there too. But out of all those people, I probably have had maybe five, or at the most, I could count all the people that I've really had problems with on both hands. But I really feel like it's only been five people. And I survived. I survived. I survived. Their vortex, I survived it. And you will too. And you will too. But remember, smile, and that'll get you through things, right? And when you smile, don't smile like you've come out of an insane asylum, right? Don't be like, don't be acting like that. No, the way you want to smile when you smile at somebody is smile like this. Smile like you're picking up a friend from the airport that you haven't seen in 2 years. That's the kind of smile you want to generate. Think or generate. Did I say regenerate? I'm sorry, I meant to say generate. That's the type of smile you want to have. Not like some crazy guy, just a calm, friendly person. And what's really kind of cool about all of this is the more you smile, the more joy you put into your practice, the more joy you're going to get out of your practice. And you look forward to coming to work. You won't be like, oh my God, I can't take these people. It's like the more joy you put in, the more happiness, the more happy you're going to be coming to work. And that's one of the really fortunate things about being an acupuncturist. I have so many friends that I'm getting older in life, you know, where a lot of my friends are trying to already figure out about their retirement. You know, they're like, oh, I only have maybe 5 years or 8 years before I retire. And I'm like, and I can't wait to retire. That's what they're like. I can't wait to retire. And I'm always like, I love my job. I don't know. I want to keep doing it until I can't. And it's completely opposite because I've put so much joy into it. It's fun. I love Chinese medicine and I love seeing my patients. And I love doing what I do. So that's why I'm doing all these lectures for you guys because I really want you to get there too, because it's really awesome. And enough about smiling. I'm not going to wave the crystals around anymore and sound new agey. But anyway, think about it. If you're nervous, oops, I'm going backwards. Sorry. And then the first thing you do. This is how I go about my working with people. If this is a new patient, introduce yourself while you're smiling. While you're smiling, like she's smiling, introduce yourself. Hi, I'm Stacy Hewitt. How are you doing? Because once again, your clients want to become confident. They want to feel like they're familiar with you. They don't want to be stuck with a bunch of needles by somebody that's acting like they're from planet Claire or something like that. Like an alien. They want somebody that they feel like they're human. They care. But introduce yourself because one way to build confidence with your patients is always letting them know what's happening to them, making them familiar. So you want to let them know who you are. Oops, I keep going backwards. Sorry. And then this is a really important question. Especially if it's a new patient, if you're working in a group practice and you already have their chart and you can look through and you've seen that they've already had a lot of treatments, and this question is moot. Sorry. I'm trying to move this picture around so it's not in the presentation. But ask them if it is a new patient, or if you don't know, ask them, is this the first time you've had acupuncture? Like I said, if you haven't already asked it, and it's the first time you've seen them, ask them if they've had acupuncture before. Or sometimes when I'm talking to a patient on the phone, I'll say, hey, have you had acupuncture before? If they're calling in about trying to schedule something, and then when you see them, if they hadn't had acupuncture before, this, if it's the first time, you can say, "You haven't had acupuncture, have you?" And they'll say, "Oh, no, no." I was like, "Yeah, I remember talking to you, and you hadn't had acupuncture." So find out if they've had acupuncture before, and if they haven't, then this is what you need to do, or this is what I do. After I sit them down and they say, no, I haven't, I'll say, because it's good for them to, sometimes the patients are nervous. They don't know, they want to know what's going to happen to them. And then once they feel confident and comfortable about what's going to happen to them, they're a little more forthcoming with their diagnosis. When you're talking to them, their diagnostic process, their interview process. So I usually say if it's the first time, if I find out it's the first time, I'll say, hey, let's go ahead and get the white elephant out of the corner of the room. Let's talk about what's going to happen to you today. So so you're comfortable. And if you haven't had acupuncture before, basically what we're going to do is I'm going to use these medical grade surgical stainless steel needles, and they're all disposable. And I usually point, you can't see me, but I'm pointing over to my Sharpies container over there. It's like there's disposable and they're single use. Nobody else has used these needles before. They're all single use, disposable, and they're tinier than a kitten whisker. Let me show you. And then I'll pull a needle out, pull it out, pull it out of the tube, show it to them, and go like, "Yeah, see, this is smaller than a kitten whisker. There's going to be there's no problem." You almost need, and I usually say, you almost need your magnifier glasses to see them. They're so tiny. And I guess if you're old like me, you do need magnifier glasses, but you can see the needles, but you're already putting into their mind that these are tiny. These are small. There's nothing to worry about. And then I'll go, and let me show you how the insertion process works. And I was like, you probably won't feel a lot of the needles. So I use a semi-Japanese style approach to my needling. So I don't sit there and needle real deep and like peck at things that much, unless it's a musculoskeletal issue, and we need to do that. But I usually tell people it's like you're not going to feel them that much. But one thing you will feel is this tube, the plastic insertion tube. You'll feel this tube probably touch your skin. You'll feel a little bit of pressure with that. And what is this tube? You tell them what the tube's about and what's it for. This tube is to prevent me from touching what goes inside you. The needle's inside the tube, and so I can't touch whatever goes inside you. It's for sanitation purposes. It's like, so you might feel the pressure of the needle, and then I do it on myself. I put the needle on LI11 because everybody needs probably a little heat released. And I was like, you'll feel like maybe the tube, a little pressure, and then I tap, and then I pull the tube off, and they get to see the needle sticking out of me. And I'm like, well, there you go. And then I take the needle out and dispose of it in the sharps container. And I say, it's not that big of a deal. There's nothing for you to worry about. It's not barbaric. Most of the needles you won't feel. And then you also tell them, it's like, I am going to be checking in with you about these. And if there's anything uncomfortable, let me know. No pain, no gain doesn't work here. We want you to be calm and relaxed. So we talk about that. And then I say, and then you explain what's going to happen next. So I'll go in a bit. We're going to diagnose you. Basically, we're going to sit down and chat, and we're going to really build a detailed picture of your health. So I'm going to ask you about your chief complaints, and then I'm going to ask you about maybe some things that might not seem related. But in Chinese medicine, everything's related. And so I'll ask you probably a few things that you might go like, why is he asking me about that? And that's because it's still related to your chief complaint. And then after we finish doing your intake and doing your diagnosis, and I figure out your diagnosis, we're gonna put some needles in you. What I'm going to do is get you on the table here. I've got a table underneath this desktop. And we're going to put a few needles in you, and then you're going to relax. I'm going to step out of the room. I'm going to give you, and we're going to talk about this, I'm going to give you a bell. So most people, and you say most people, so then they don't automatically get nervous about the bell and say, most people don't need to use this, but I always like to give it to people so they have a safety net. They feel like they can communicate with me if they have any problems come up. And very rarely do I have anyone ever ring the bell, but I'll give it to you just so you feel safe. And so that's what we're getting ready to do. And then I'm going to step out of the room for about 15 to 20 minutes. Then I'll come back in. And if the person, if I'm doing both sides, then I'll tell them I'm going to flip them over. I'm taking the needles out. I'm taking the needles out. I always tell them that first so they don't think they're going to have the needles in and you're flipping them over. But I'm going to take the needles out. Then we'll flip you over and continue from there. Do you have any questions? If at any time you do, ask away. That's what I'm here for, not to just put needles in you, but to answer any questions. Feel free. And does everything, do you have any questions so far? No? Okay. Well, let's continue. So that's what I do. That's what I say. You really want to, like I said, let people know what you're getting ready to do so they know what's happening. They've come to a stranger. They've never had acupuncture before. They don't know what you're going to do. They're hoping that you don't wave a chicken egg over their head and crack it in the bowl beside them. They don't know what you're going to do. So explain to them what you're going to do step by step so they feel comfortable about their situation. Explain, like once again, these are all slides about explaining. Tell them you're going to give them a bell in case they need you. If you don't use a bell like this and you say, okay, well, I'm going to get all technological and give them a wireless doorbell. I've had other practitioners that I know that use a wireless doorbell for their different patients. Make sure you check those batteries on those regularly. It's very easy for you to get into it and think, oh, I look so suave because I've got an electric doorbell. And then you find out, you come back in, and the patient's like, I've been trying to get up with you, and I've been pushing this the whole time. And it's because the battery's worn out. So that's why I like these type of bells, a little hand bell. And very rarely does anyone ever ring it, but it's always good for them to have it in case they do need you. I remember when I was in clinic, the clinic rooms were on this side of the hall, and then we had a hallway, and then another big hallway, and then another area where the practitioners or the students would go and write their notes. And I had a older lady, and she was coming in because she had a lot of polyuria, meaning she had to urinate a lot. And I'm not a healthcare practitioner. I don't know much about all of this. I mean, I know what it is, but I know how to treat it. But we put needles in her, and we went into our little student area where we were supposed to go, and we came back in, and she's like, I've almost peed myself. I've been hollering for somebody to come help me, and nobody came to help me. And I felt horrible, horrible. And it was because we had no notification system as students. I just felt horrible. And I remember that 13 years later, I remember that. And I always give people a bell so no one ever has to experience that again. Let's see what the next slide is. And then after that, okay, explain to them that the needles shouldn't be uncomfortable. This is not about no pain, no gain. Sometimes people think that only if things hurt, that means they're helping. That ain't the case. It doesn't mean if you don't feel it, it doesn't mean that it's not being effective. But Also tell them acupuncture is relaxing. Let them already know. Go ahead, and it's not subliminal manipulation, but it's going to go ahead and planting what's going to happen in their brain. Let them know that they're going to relax. Tell them that acupuncture is relaxing. And most people, this is what I say. It's like, I'll step out of the room, and when I come back in, most people are snoring because it's true, because acupuncture has a very strong effect on the parasympathetic system. Okay, guys, I've got to go. I've got a patient coming in. We'll continue with part two. Like, subscribe, and check out the next part of this. This is probably one of the most important lectures that I do, because a lot of schools don't go into a lot of detail about this. They just say, okay, here's some needles, go down there and treat your patients, but you really need to know how to interact with them. Okay, ciao.